All right, thanks for coming, everyone, for this maiden voyage of the brief history of U.S. healthcare training. This is a thing that, the more I worked here at Definitive, the more interested I became in, and it's super interesting. Um, I will, however, already disclaim the fact that I've already broken one promise, which is this won't be brief. Um, my plans were having this training, go from basically until it became interesting until 1910 in one session. And honestly, we're probably not going to get past World War II. And beyond the metaphysical sense of that statement, we're not going to get past World War II because basically I either go into a certain amount of detail that's valuable or I don't even bother. And so we know, anybody who knows me knows which side of that I fall on. Um, like I said, this is the first time I'm doing this training, so please let me know what I can do to improve it. As I've already stipulated, there's going to be a part two of this, so ideally part two is better than part one. So let's see what I can do. I usually try to have some kind of interactivity in my trainings. This, however, is basically me telling you a story. So it's not as interactive as I'd like it to be. But if you have any questions or comments or concerns, raise your hand, speak up. I don't mind being interrupted. And we'll figure it out together. I will say I'm not, as one of my favorite history podcasters says, he's not a historian, he's a history enthusiast. So that's kind of how I am too. So without further ado, we'll talk about my approach a little bit. So the first disclaimer is, like I said, I'm telling you a story. This is a narrative. Anytime you create a narrative, you flatten things, you simplify things, you shave some edges off to make a transition smoother. History is the most complicated. It's far more complicated, interesting, and thrilling than any fiction you'll ever read. That's what I firmly believe. But I have to create a narrative, and we're only here for about an hour. So I will do a kind of a combination of chronology and topic, meaning I'll basically stick to a few different time periods and then go kind of topic by topic in that time period. There's going to be a little bit of chronological jumping around, but I hope that's okay. And again, if you have any questions or need any clarification, speak up. Throughout this, we'll say series, I guess, you're going to be paying attention to a lot of different threads. And the main threads, if you had to categorize them as briefly as possible, is there's the thread of science and research and development and just new capabilities that humanity has now that it didn't have last year. That's a very big thread. Then there's the thread of what are private institutions doing, be those individual businesses, be those labor unions, be those individuals. And then there's what are the public institutions doing, what are governments doing? And then there's world events, stuff that doesn't necessarily have to do with healthcare, but which very much affects the business of healthcare. And typically, historically speaking, people always strive for equilibrium, right? We're animals, and animals know that you need to achieve equilibrium, otherwise you die. And that's built in. And so typically what we try and do is between the individuals and their institutions, we try and go back and forth, and we, eventually settle on some kind of equilibrium. Of course, the world isn't stable, so something like a scientific development, or something like an epidemic, or something like a war screws things up, and then you have to start over again, finding equilibrium, but now in a new world. So that's, again, in any historical story, that's what you're going to hear, and that's what you're going to hear here. All right, so our play has 4 acts, and I like silly naming, so I named them Silly Things. And today we're going to talk about the first 2 acts, but the 4 acts are knowledge and power. And basically meaning that you know the phrase knowledge is power, but knowledge also draws power that already exists. And the second is necessity and invention, and as I write there, historically speaking, necessity means pain and suffering and death. Then kind of the third act is flush and rush, and I'm going to leave that one alone just to keep you guessing. And then the last one is bubbles and synthesis, how they burst and how synthesis is achieved, or at least how we attempt to achieve it. So, questions before I dive in to knowledge and power. All right. So, knowledge and power. The years we're going to be talking about are Yor to 1914. And that's a really big period of time to discuss in just kind of one act of the play. But the reason is that basically, from a healthcare perspective, 1880 is no different than 880, which sounds ridiculous, but is very, 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 very true. There are different kind of fashions come and go, historically speaking, but largely any advances that are made in medicine are what medical historians now call empirical medicine, which is another way of saying trial and error. So lots of really cool stuff happens. Lots of errors happen during that trial and error period. And if you're interested in any of that, there's a couple books and podcasts that I recommend up there, The Dollop and Sawbones, really good. But basically between, like I said, from 1880 to 880, life expectancy was about 35 years old. There's lots of reasons for that. Child and infant mortality is a big deal, and the way math works is the younger they die, the more they skew the number down. If you were lucky enough as a child to live to 5 years old, your average life expectancy ended up being 55. So if that helps you center yourself a little bit. So that's kind of the situation that we're handed up through, kind of the end of the American Civil War. So like I said, there's empirical medicine, which means we try and fail, but sometimes we succeed. A couple of these lightning strikes are the discovery of vaccines. Huge deal. This is kind of at the very end of the 18th century, and like I said, each of these side notes I'm going to talk about has gallons and gallons of ink spilled on them by researchers and academics and stuff. So they're all really cool stories. So I recommend you do a little bit of digging or sit down for story time in my office at another time. But the story of vaccines is really cool. This person named Jenner, smallpox was going around everywhere. It's been going around for quite some time. And he noticed that dairy farmers and people associated with milk cows tended not to get smallpox as frequently. And not by a little bit, but by a lot. And he eventually, and again, this is basically the Dark Ages, he basically found a way to combine cow's blood with people's blood, which became a vaccine, because you're putting something foreign into a human's bloodstream. And it worked. But again, it was a lightning strike. The next vaccine wasn't discovered until late 1800s, which we'll talk about in a second. And so that's kind of the theme with all this, is we make some kind of advancements because we stumbled onto it. We don't really have the theoretical underpinning to do anything consistent or to advance rapidly. Another very useful one is in 1846, anesthesia is discovered. Any kind of surgery you had before then, you were fully awake during. Incidentally, this anesthesia was first done in Boston, so yay Boston. It was for a dental procedure, although by dental procedure I mean like a jaw restructuring. Another interesting one that people stumbled upon, and this is kind of a depressing one, but I mean, again, most advances, historically speaking, are depressing at some point. So this person, I believe in Switzerland, named Semmelweis, he was a very young doctor, and he joined this practice or hospital, and they did all kinds of stuff there. They, sick people, dying people, surgeries, autopsies, and everything. And they had just a terrible rate of childbirth deaths and birth of newborn children deaths. And he really wanted to research why, and he couldn't figure out why. But he did notice that other hospitals, or just kind of midwiferys that didn't deal with other types of diseases didn't have the same mortality. And long story short, he discovered that he started instructing what were the equivalent of interns at the time, he started instructing them to wash their hands after they do autopsies on cadavers before going to deliver a baby. Totally new. And lo and behold, the childbirth death rate plummeted in that hospital. Of course, because this is still kind of the dark ages, medically speaking, everybody thought he was full of shit. And his practice didn't really spread for another 40 years. So who knows how many more women died on the child birth bed because nobody really bought his whole hand washing thing. So that's some of the lightning strikes that happened because we don't really have theoretical underpinnings. Questions about any of that so far? All right. So then there's what researchers, and again, researchers need to come up with better names for things, but they call it the health transition, which is really cool because basically from a very real standpoint, the history of the medical industry starts around 1870. And I don't really show a lot of that graph, but that graph is life expectancy for all continents on Earth. And you can just see it starts to explode. For what we might call the Western world explodes around 1870, and the latest, the last explosion is around Africa in about the 20s. But all of a sudden, across the world, I mean, historically speaking, all of a sudden, things start getting better. And there's lots of contributing factors. There's a very big reduction in what we call great power wars around the early 1700s. So, there's still wars, but it's not really big countries fighting other really big countries that create higher death tolls. But other than that, really, it's just advances in medicine are completely responsible for all of this. And as you'll see, the advances I show here, they're not, apple falling in the head, eureka moments that can't be replicated. These are actually advances in theory, right? These are understanding how the world works that can lead to future things. It's creating a stepping stone. So there's the stethoscope. Which huge is the germ theory from Louis Pasteur and Koch. So this is the very basic concept that disease is caused by little things called germs. Again, huge deal. Only, what are we in now? 2018. Only 150 years old. Not that long. And again, as I mentioned, there's the hand washing thing in 1847. Only after Pasteur and Koch kind of show germ theory as a thing do doctors start washing their hands. And then shortly after, they come up with methods of sterilization. Basically, doctors start soaking their surgical implements in chlorine, which is a very effective antiseptic. Probably didn't help how bad surgery hurt, but that's a different issue. And then the first, what we would call a pharmaceutical, was created, which was to treat syphilis. And that was in 1910. So, again, drugs are historically a very new thing. I mean, there have been, again, if you want to be entertained and horrified, there's a very long and interesting history of elixirs and snake oils and all that fun stuff. And there's also a long history of kind of the more shamanistic medicines that actually have some kind of rhyme and reason to them, but again, don't necessarily have the theoretical underpinnings that what we would call modern medicine has. But pharmaceuticals as we know them, a thing that can be mass produced and replicated and duplicated and doesn't necessarily have to be grown, started just in 1910. One thing, I separate this vaccine explosion because I really want to drive the point home, which is, so the first vaccine was 1797. Yay, cows. Incidentally, vaccine, the French word for cow is vaca. That's where the word vaccine comes from. It's tribute to cows in your body is the word for vaccine. So 1797 is the first vaccine. The next one is, what is it? I believe a cholera vaccine in 1879. So there's 83 years from vaccine number 1 in history to vaccine number 2 in history. That's, depending on how you define a generation, 2 to 3 generations. But then, again, this is in, what did I say? 1879. By 1879, we have germ theory. We have sterilization. I don't put it up here, but we have microscopes at this point. So there was a 83-year gap, but then on average from 1879 until now-ish, we've had developed a new vaccine about every 5 years. So again, historically speaking, that's an explosion. That's crazy. And we'll talk a little bit about the effect that has socially in a little bit. But basically, that's what happens there. We also have new technologies like radiology, x-rays are discovered, or rather they're discovered a little earlier, but they're first implemented in trying to look inside someone's body in the early 19-teens. Not for bones actually, but to look inside someone's lungs for tuberculosis. But obviously it's useful for looking at bones too. So this is the health transition. As you can see, hits US around 1870. So it's a very important thing to remember. All right, so all of a sudden we have all these vaccines. There's the health explosion. And you'll see this pattern happening a lot where we discover something and then the private sector reacts and then the public sector reacts. That's often the cycle of any kind of innovation. So in 1850, the only insurance that existed was accident insurance. And before I go on, it's important to keep in mind what insurance is, right? So insurance can only exist if there are enough numbers somewhere that I can make a safe bet as to when something is or isn't going to happen. Without that data, I can't insure anybody because I don't know how much to charge them. I don't know how much to pay out. I don't know what my threshold needs to be and all this stuff. Basically, it's a recipe for a bankrupt insurance company if you don't have that data, or an insurance company that prices itself out so much to avoid bankruptcy that nobody can afford it. So and the reason I make that point is it makes very little sense to insure something that happens all the time, or that is so expensive to cover that people can't afford it. So early 1800s, there's the Industrial Revolution, and people start, or businesses start throwing human bodies and death and suffering in order to make us more profitable, which is great. And then humans eventually react. Again, we're talking about the equilibrium people try to find. So humans react and they improve safety. So as soon as they realized we can improve safety, which means reduce accidents, they start to say, this is something we can control, let's make money off of it, let's insure it. So that's why until 1850, the only dark ages time, there is this kind of insurance and that's it. But then in 1890, you see sickness insurance introduced. And I just really am trying to drive the point home. I hope I'm not belaboring it, but before 1890, it's not like they didn't want to insure sickness. It's that it was such a random act of God and you couldn't do anything about people being sick that it's a dumb idea to even imagine you can try and insure it. But going back to our timeline, so 1890 they introduced sickness insurance. Well, what had happened 30 years prior? Disinfection, germ disease, some drugs were starting to be formed. So now it's a thing we can control. So now it's a thing we can insure. Before it was probably, if we insured it, it's a money loss. Now it's a money gain. So then we go to disability. Again, very interesting. 1911. It's 20 years after sickness insurance happens. So we start to have there's the vaccine explosion, right? So that helps us get rid of all these sicknesses that kill people young. And then we start to approach disability insurance, which is really just a combination of accident and disease. And we'll talk in a little bit, but as surgical procedures get better and better, disability insurance becomes a viable option. Because again, before, if someone got injured, let's hope they didn't get injured, we'll try not to get them injured. If they do, if they go to surgery, they're probably gonna die, right? Because their doctor just did an autopsy on someone who died from malaria. So now that we have improved conditions, both working and medical, it makes sense to start insuring people from a disability perspective. All these insurances, by the way, are for an individual company for their people. There are no third-party insurers right now. This is a company says, if you get hurt, my employee, James, then I will pay for your wages while you're gone, while you get better. So it's the beginning of, not the beginning, but it's a trend of companies really investing in their people. And there's no such thing as a third-party insurer right now. It's just an agreement. It's an employment agreement. The part of the advantage of this, aside from not having an existing infrastructure, is that a big deal with insurance, all kinds of insurance, is you want to avoid adverse selection, which basically means you want to make sure that you, by dint of offering insurance, you don't welcome all the people who are going to drive you bankrupt into your arms, right? So if you have health insurance and you say, hey, I'll pay for your doctors, the first people who are going to come and visit you are sick people. And so you want to make sure your insured base includes plenty of healthy people to offset the cost of the sick people. Part of the reason why I'm pointing this out is the only place they can really enforce who's in their pool is an employment agency right now, is a company. And it actually makes sense financially because generally speaking, you don't have a lot of sick and dying people working for you on your factory floor. They're generally healthy, otherwise they'd be home dying. So you already have this pool of more or less healthy people, at least right now. And you, as a business owner, are incentivized to keep them productive and healthy because they make you money. So there's a reason for you as a business to do this. It works financially, it works as far as incentives go, and obviously the individuals benefit from it as well. This is a brand new thing. This is, in many ways, life-changing. As an HR person, I know for a fact that most people kind of roll their eyes at insurance or don't even think about it ever. But this is a very new technology we have. If you think of the car as new, insurance is about that old. So in as much as the car changed life on Earth, insurance has done the same thing too, it's just less visible. And the last really interesting thing is this is in 1910, I believe. This guy named Abraham Flexner, where was he? At Johns Hopkins. He created this massive report. And he basically made a quality assessment of all the medical universities and all the doctors, in as much as he could. He made this quality assessment of all these universities and doctors in America. And again, keep in mind, up until 1870, a doctor is anybody who could convince you that they're a doctor. There are plenty examples of people having a piece of paper that's attached to no institution, acting as doctors for decades. That doesn't really stop in 1870, but anyway, so we start having these medical schools. We have this theoretical underpinning. We're learning new techniques. Schools are arising so people can learn those techniques. And just like nowadays, not every school that pops up online is a good school, right? It was the same equivalent back then. You have all these kind of for-profit schools, and that some of them were very good, some of them were degree mills, and nobody knew what was what. So Flexner, he creates this report. He basically makes sweeping recommendations. And he isn't anybody. He's just a researcher and a doctor. But he makes sweeping recommendations about what a medical school should be, what it should look like, what the curriculum should be, what a doctor's responsibility should be. And more or less, the medical community accepts this. And this is one of those things that if you look at Flexner's recommendations and then look at medicine today, it hasn't changed very much. Like, this guy really changed the history of modern medicine, and nobody knows his name. Of course, there are some downsides to the Flexner report. So about half of of medical schools got shut down immediately, which is ostensibly good. And he also really recommended people raise the bar for applicants, for people they let into the school in the first place, which is also ostensibly good. Unfortunately, especially given the historical time, this had a very adverse effect on historically marginalized groups. So up till that time, because it was kind of an open playing field, people could go to a university. It was basically a gold rush, but for medicine. There was a lot of advancements for women in the medical field. Like, there were plenty of co-ed universities, well, not plenty, but there were a decent number of co-ed medical schools and a couple female-only medical schools. And basically, Flexner recommended that people, I said Flexner. Flexner recommended that only men be admitted for reasons. Also, there were 7 black universities or black medical school programs, and Flexner said they probably don't have the capacity to do this. So of the 7 black medical schools, only 2 remained open. And whoever graduated from that was basically relegated to only taking care of other black people. So not an unassailable good. He improved the medical industry, but it wasn't unalloyed good. Also, part of as far as supply and demand goes, it's really good to improve the quality of a thing supplied, but he also cut in half all the open medical schools and recommended we restrict the number of doctors we have, which creates a shortage, right? It creates a doctor shortage, which we really haven't ever gotten out of. We just have shortages of different types of healthcare providers from then until now, basically. Basically, up until the Flexner report, there's no such thing as a shortage of doctors, because what the hell's a doctor? So that's the situation there. Any questions about any of that so far? Amy?
Why was he taken so seriously if he was just like a no-name?
Well, I mean, he wasn't a dummy, right? So first of all, he was with Johns Hopkins University. It was a well-known medical program. So there was kind of an informal ranking that people were aware of. There were also other institutions, like there was the American Medical Association already existed, stuff like that. So he got the backing of the institutions that matter. And I think a lot of his assertions that we consider the most ridiculous today were not even second guessed at that point in time. So it's a combination of a lot of things. But I mean, he did the research. He graded every school out there. Like he basically did this massive legwork that nobody else even thought to undertake. And so if you're the only game in town, people are probably going to go with you.
Thanks.
Yeah.
What year was the Flexner report?
1910, I think. Yep, 1910. All right, so again, going back to the threads, research and science create some solutions, then a market is formed, not like it is formed, but emerges, and then government steps in to regulate or affect that market. The very first, in US history at least, the very first foray of government into healthcare is the Freedmen's Bureau. So it was a series of hospitals and physician groups were basically built or created to service freed slaves in the South mostly, because they didn't have any money. And right now, healthcare is entirely a cash economy. So if you don't have money, you don't get healthcare. And all of a sudden, in the late 1800s, there are a whole bunch of people in America who have a right to healthcare and don't have any money, not a penny, because they've never had a chance to earn it. So the government steps in and says, okay, well, this is a big enough gap that we are going to do something about it. There were a couple other attempts at kind of the government stepping in ahead of time, but this was the first one that actually went through and became official. Unfortunately, it didn't last very long, and I think the program only lasted for about 10, maybe 15 years. So not great, but it was something. And then the government gets involved in pharmaceuticals. And like I said, the history of elixirs and salves and balms is a very interesting and entertaining and depressing one. But the very first patent for an elixir was around 1712, I think. And but that wasn't like government getting involved with medicine. That was like patents were invented, and so things that already existed got patented. So basically, from ages of elixirs and herbs and stuff, nothing was ever regulated until early 1900s. It's a really long time. But government starts to realize all these outcomes we want to improve. We've started to get, again, keep in mind the timeline, right? So this is early 1900s. We've had about 30 years of vaccines, maybe 40 years of vaccines. And so we see that, approaching things scientifically has dramatic effects. So let's approach food and drugs scientifically. And at first the bar is very low. Like this Pure Food and Drug Act is basically like you have to prove that the thing you want to sell doesn't actively harm someone. That's about the bar, which is a hell of a bar. It's good because we didn't have it before. And you had people like, I forget his first name, but Dr. Wiley and their self-appointed poison squad, where him and his researchers, these are all medical researchers, they would eat different things, different substances to see if it was bad. Like they were their own guinea pigs. And this person, Dr. Wiley and his cohort are the ones who kind of created the push to get this first act through, because by using themselves as guinea pigs, they found out that, hey, this stuff's really bad. Maybe we shouldn't allow people to sell it to other people. So really, that's the first breach. That's where healthcare, in any meaningful sense, at least as far as our purposes are concerned, that's where healthcare started. It's around the 1870s is when anybody could do anything that was replicable and scalable, and then to about 1910, it progressed in this, like I mentioned before, it progressed in this balance of new technology. Individuals and private entities do something with it. Government tries to smooth out the edges. And that cycle, you can see that churning a couple times right now. Then we enter Act 2, which is necessity and invention. And again, what is necessity? Pain, suffering, and death. Does anybody have any questions before I move on to Act 2? Righteous. All right. Although I will, before moving on, just a thought experiment. You don't have to answer me out loud, but it's an interesting thing that in your quiet times to think about is we know what happens in 1914 and after. But it's interesting to think about, given the cadence that was happening before 1914, it's interesting to wonder how things would have looked, just from a healthcare perspective, how things would have advanced and looked without the events that are about to happen taking place. I don't like having to be responsible for counterfactuals, but I like thinking about them because everything affects everything else. Anyways, just something to think about. Because every time an external event disrupts that equilibrium that we are always trying to attain, it affects one group of people one way and another group of people another way. And then this group finds themselves in a new landscape, and this group finds themselves in a new landscape, and now both groups find an equilibrium, and they tend to end up with different things. It's basically evolution, just evolution of systems. So, necessity and invention. So we have a Great War and a Great Interbellum. So the Great War is World War I. They didn't know that that was what that was, but it was the Great War to them. So up until now, these advancements have been like childhood diseases, things that come on suddenly. It's been very disease-oriented and kind of surgery-oriented, but in the sense of keeping people alive in the day-to-day. But when all these people start going to war, you start paying attention to different things. That's just how research works. So their focus in medical advancement during these years are a lot more war adjacent. So antiseptic medicine, blood transfusions, basically stuff that keeps soldiers alive. Luckily, it has good benefits that, after the war is over and this stuff becomes a little bit more widely adopted, hospitals suddenly, and kind of for the first time, stop being a place where people go to die and start being a place where people go to be kept alive. Like, that's a big deal. If you don't have antiseptics and you don't have antibiotics and you don't have blood transfusions, the treatment's probably going to kill you, even if it fixes the problem. So thank you, World War I, for that. We also have the first attempt in America at nationalized health insurance. And it was under the Wilson administration. This is in I think 1915. It was right after the start of the war. And a really interesting thing happens that you'll see recurring, kind of a repeating theme like in music through American history, is historically America has very much defined itself using negative space, meaning we define ourselves by what we aren't as much as by what we are. And historically, America has juxtaposed itself against Europe, right? Just like we're the teenager, Europe's our parents, we rebel against our parents. Very common phenomenon, right? So this very first breach into nationalized health insurance looks, it makes sense. Around 1880, European nations started adopting nationalized health insurance. The first one to do so was Germany. What is now Germany, which is tricky because that's who we were fighting at the time. So this is form of health insurance, nationalized health insurance, that who invented it? The people who are killing our boys right now. And so, like I said, there's this recurring theme you'll see over and over of, because of the way we define ourselves as a nation, it seeps into different ways that we make choices as a nation. And then the war ends, and then we have the Roaring Twenties, which is not a lot medically happens during the Roaring Twenties. And I think part of that is, again, it's only a 10-year period, so you can't have revolutions every 10 years. Also, instead of a lot of medical advancements, there's a whole lot of technological advancements happening during here, proliferation of electricity, stuff like that. But one thing that I was trying to think of what I could talk about with the Roaring Twenties with you guys today. And I started thinking of timelines. And again, it's easy to kind of look at this stuff in terms of, broad strokes, dates, stuff on pieces of paper. But looking back at our timeline, vaccines only been around for about 30 years, or at least more than a couple of vaccines have only been around for about 30 years. Only a few years ago, and again, a few years ago meaning your mother's generation, right? So your mother's generation, their life expectancy was 35. Yours is now between 45 and 55. Again, that's crazy huge. You don't know those numbers necessarily because we know them retrospectively, but people are living longer. People are dying less from childhood illnesses. Childhood mortality rate in the past 30 years, in the past 35 years, infant mortality rate has been cut in half. In the past 35 years, maternal, childbirth deathbed mortality has cut in half. So I'm curious, and I don't know how to find this out aside from reading a ton, about how much the advancements of medicine 30 years prior contributed to kind of the reckless optimism of the Roaring Twenties. Just me musing. Don't have a story to tell, just thoughts. Of course, the Roaring Twenties are so roaring because credit is made incredibly available, probably too available, and as most of us know, when credit is made too available recklessly, it leads to a crash. So then we have the Great Depression. Yay, necessity. And the revolutionary thing here is that not having money is really hard. I don't know if any of you knew that, especially when everything's a cash economy, right? So you either, if you want access to healthcare, you either have to have an employer that provides it, or have money. And unfortunately, during the Great Depression, most people had neither. So all these hospitals and doctors that they've been really ramping up. Everything's been getting better, right? They've been getting better, but now nobody can afford them, so they're just empty. So the infrastructure starts to crumble, right? If nobody's there to be in the hospital can't make money, hospital can't keep up repairs. And again, the Great Depression is only about 10 years long, but if you own a house, a lot can go wrong in 10 years if you don't have any money to fix it. So again, the world has given us something, so we have to find a new equilibrium, so we come up with new solutions. And all these different types of proto-insurance, what we would consider health insurance now, all these different types of insurance start to come up. And by proto-insurance, I mean different than just your your company paying for your health care, right? Because that's not insurance, that's just your company paying for your health care. That's the same thing as a company town hiring a doctor to live in your town. When I say insurance, I mean a third party who arbitrates between providers and patients. So we have a few different examples here. Kaiser, again, it's a story, right? So Kaiser was a shipping company, and what they did was they partnered with a physician group or several physician groups, and they basically created this, what they called prepaid care. So they said, we're going to pay this physician group X number of dollars, actually it was X number of cents per person per month, and if our people need healthcare, they go to this physician group and they don't have to pay for anything. That's how Kaiser started. And then around, when shall I say, 1933, Kaiser opened that up to people who weren't just their employees. So that's kind of the start of healthcare. They're an employee or a person, an employer, and then they had Kaiser who coordinated with them with the physician group. We have Blue Cross, which is the first employer-sponsored health insurance. This is in Baylor, Texas, 1917? No, that's Blue Shield. 1929 sounds about right. So in Baylor, Texas, 1929, this group of not Baylor, Texas, at Baylor University in Dallas, Texas, in 1929, this group of teachers come together and they, again, prepay insurance. So they basically make a deal with a hospital, not a group of physicians, but a hospital, and say anybody who is a member of our teachers union can have access to certain services at this hospital if they pay this much in dues. So again, the third party here is the hospital. It's the hospital providing its own insurance with the help of a union and the individuals. And then last we have Blue Shield, which is a very similar story. Blue Shield was started by kind of this conglomeration of logging and kind of forestry companies in the Pacific Northwest, and they again teamed up with physician groups so their people could be taken care of, and then they expanded to teaming up with hospitals as well, and they started negotiating separate rates with these hospitals that they had to deal with. Again, this is kind of the first time this has happened. So it's not only we have insurance, it's we get discounts because we have a lot of people on our plan and we can provide you bulk. Again, standard to us right now, revolutionary. And that was, again, not that long ago, 1931. So these are all different ways of the market trying to fix the fact that nobody has any money and nobody has any employers. And the only two ways that people get healthcare in the current world are money and employers. And professional groups like the American Medical Association hated this, hated it. They, for lots of reasons, a very cynical reason one might speculate is because they got dues from each doctor. So one doctor, one set of dues. And when doctors grouped up, they only had to pay one set of dues for one group of doctors, and AMA started losing a lot of dues. That's one very cynical explanation for why they didn't like this. Also, there was the stigma. The AMA lobbied against this stuff. They called it socialized medicine. And this isn't national health insurance. This is groups of physicians working together and making deals. They called that socialized medicine. Very fascinating how that term gets used a lot in different ways. So still in the Great Depression, some things move forward. And again, it's interesting to see the different types of advances that happen during wartime and during non-wartime. So the advances that were made here are penicillin, which is good, antibiotic, insulin, heart valve surgery. These are not necessarily things that a soldier needs on the field, right? They don't need a new heart valve. These are the things that, okay, we've gotten rid of the stuff that kills us young. Now let's get to the getting rid of stuff that starts killing us a little bit later. Still pretty young, but starts killing us a little bit later. And like I talked about, just like before, the private sector is trying to come up with solutions. The government's also trying to come up with solutions. So the government creates the Food and Drug Administration, which is kind of an extrapolation of our prior Poison Squad and their work. And they also create the VA healthcare system. And this is an interesting thing that starts, which is because right now it's the Depression. Everyone's scrambling for an answer. We're trying a bunch of different things, which is good. This is where things start to run in parallel. We basically have different parallel healthcare systems. The government has a VA, and people have employers who give them stuff, and then there's a private market which is starting to develop, but which is new. And you'll see a theme up until today that we aren't very good at ever converging those things together. So things arise organically, like in any laboratory, right? But we don't ever really pick a lane. And then National Health Insurance 2, the second attempt. This was, part of FDR's New Deal. Didn't go through very well. Interestingly, this one wasn't so much because of lobbying by the AMA, although there was that. Uh, but it was because there wasn't a lot of appetite for it. There was just kind of, there was such a loss of faith in government and people should be taking care of us that nobody really was interested in pushing very hard for it. Just want to make sure we're good. Like I said, no way we're getting through the end of World War II. So, 1939 to 1945. The VA grows dramatically, of course. And again, we shift back to wartime medical advances. A lot of antibiotics are being used. And again, those are good for all times, but pretty much the mass production of antibiotics during these periods was exclusively to keep soldiers up long enough to get shot down permanently. And then a really pivotal thing happens, and this is as pivotal as the Flexner Report, but again, as obscure as it in modern knowledge, which is 1943, the government freezes wages. It says, okay, employers, you can't offer any more wages. You can't, increase people's wages anymore. And it makes perfect sense why, right? If wages increase, inflation happens, things cost more. Right now, the government's spending a lot of money buying things because it's fighting a war. So if we keep costs down, we'll keep our government spending down. We won't accumulate all this debt. It'll be very good. That's the logic. Of course, frozen wages, the opposite of inflation tends to be a recession, right? It's a constant struggle between those two things. So the wages freeze, a recession happens, and employers say, wait, we already have a limited workforce, right? Our workforce just got cut by a lot because we're sending people elsewhere who would normally be filling our factories. So we don't have as many workers. We don't have an incentive to draw new workers because we can't say, hey, we'll pay you more than the guy who's paying you right now, because that's off the table now. So employers and unions work with the government to come up with a workaround, which is they will pay for people's health insurance. So that doesn't increase wages. You're still paid $2 an hour, but we give you this benefit. And what's good for the company is, A, we can attract workers when workers are scarce, and B, whatever we pay on behalf of our workers is tax-free. So incentives aligned. During this time of wage freezes, this is how we get around it. And that works, at least a little bit. Little do they know that this is not a temporary solution, right? Nobody is planning on this no one is planning on this being a permanent solution. It's just a wartime stopgap. And then some more legislation happens, and like I talk about, this is lots of different things going on. So, we have the McCann-Ferguson Act. Oh yeah, this is, so on one hand, in 1945, we have this McCarran-Ferguson Act, which is basically makes it so the federal government can't regulate insurance companies. They have to be regulated at the state level, which means like antitrust and monopoly laws can't apply to them. Lots of federal regulation can't apply to them. This comes in to effect much later on during the Affordable Care Act. So there's that. And again, keep in mind timing right now. Like, this act is passed in 1945. A, there's a war on, but B, insurance as provided by a third-party insurer is like 10 or 15 years old. It's basically the equivalent of us, of what the government's doing right now with, trying to figure out how to regulate the internet. It's like this crazy new thing that's developing really quickly, and nobody quite knows how to make it work the way we want it to work. Some parts of it are working right now, some parts of it aren't, and government's starting to take a crack at it. So on the one hand, we have this McCarran-Ferguson Act So it says, sorry, not federally regulated at state level. On the other hand, we have the Hill-Burton Act, which basically is the government throws a ton of money at hospitals and medical schools so that they can improve the crumbling infrastructure that started during the Great Depression and is still going on, and to kind of bulk up how many medical professionals there are out there, because we need them. Because every time you introduce a new system and you commit to that system, that's great, but now you have to keep that system up and running, otherwise it will fail and then you'll have no medical professionals. And so that's what the government's trying to avoid. So on one hand, it's propping up the healthcare industry by giving money to hospitals and medical schools. On the other hand, it's saying we can't regulate it at a federal level. And then on the third hand, there's National Health Insurance attempt number 3 as part of Truman's Fair Deal Act. This is probably the closest we've ever come to actually getting it passed. And this is the attempt that was really pushed against by the American Medical Association and similar lobbying groups. In fact, the first, I forget the name of it, but like the first campaign advertising company came into existence around 1935. And like that company that kind of created the thing was employed by the American Medical Association to fight this. And again, it's very tricky because right now we're fighting the Germans, we're fighting the Nazis, we're fighting the bad guys, and what do they have? They're socialists. They have socialized medicine. We can't have what they have. They're killing our boys, right? So this happens again and again. The other thing is a disconnect with labor unions. Basically from this, not from this point, but from 1960 or 1970 on, labor unions become less and less of a player in policymaking. But at this point, that probably would have passed if labor unions had been incentivized to get nationalized health insurance passed, but they weren't, because the wartime wage freezes gave them a thing that they could bargain for, another thing they could offer their people to entice them into their union. So having health insurance be a thing you could bargain for, and having health insurance be a thing you could negotiate with, was actually good for the unions. So they weren't especially incentivized to take away one of their own bargaining chips, even though take away one of their own bargaining chips. Okay. This was a sign that I need to pause. So here's our interlude. We're checking back on our threads. So what were our threads? I'll pitch that out to the audience. Who wants to give us a report on our threads? Science and development. What's happened since then? Since 1870? Give me an overview. Or I'll volunteer you. Insurance. So that's the insurance is a new thing. That's a new business incentive, right? That's the private sector. So the private sector starts company towns, and they take care of people in that way. Then they pair up with physician groups and hospitals and take care of them that way. And then they pair up with third-party providers and pay for people's health care with pre-tax dollars and take care of them that way. And that's kind of the way the private world works. That's the evolution there. The evolution of the public world, the government sphere, is very standard. Like, there's nothing to regulate, so we don't regulate it. Something appears, and it seems to work, but not totally great. So then they step in and they try to regulate it. And then different things happen which change priorities. And so government tends to shift on whatever is the most urgent at the time. So at some times a thing is regulated, then there's another urgent thing over here, and that gets ignored, and they start regulating this over here until it becomes a little bit schizophrenic. And then the third thing, or the fourth group, because we had science, private, public, and what's the fourth group? Oh, world events, right? So the fourth group is world events. There are wars, depressions. I didn't even get into like there was a flu epidemic of several different kinds of flu right at the end of World War I, as if the world hadn't been through enough. And all these different things come in and screw up the equilibrium that we're all trying. We all just want a normal, stable, happy life, right? But all these events keep throwing things off, and they throw it off, and then we have to find a new equilibrium in the new world that we're in. And currently, the new world that we're in, at least at this point in the presentation, is World War II is over. Europe is basically in ruins. And there's only a couple world powers left standing, and America's one of them. And that is the world in which we'll find ourselves for next lesson. Any questions? All right. Thanks for coming, everyone. Hope to see you next time.